I started doing radical prostatectomies about 25 years ago, and at the time only open surgery was being done. And then a laparoscopic surgery developed, and that was keyhole surgery, which was technically very difficult, and people who were doing it often caused a lot of side effects from it. And keyhole surgery didn't really take off until robotic surgery became readily available, and the robot made it easier for the surgeon to manipulate the sutures and the instruments, and that has now become the standard way of doing it in most of the Western world. And the reason for that is because it's easier to train surgeons, and it allows surgeons to achieve a higher standard. Now, in my own personal experience, I found that having done a lot of open surgery before doing keyhole and robotic surgery, that it actually reduced my outcomes, because I found that using my hands gave me a lot of advantages. Plus, a lot of the keyhole instruments can still be used through an open incision. So I actually use a combination of techniques, but I still use the open operation, and I find that there's virtually no detriment. In fact, I find it beneficial to use the open operation, but I accept I'm a dinosaur because everyone is being trained now to do robotics.